guys, Jeff here at DC Sports Training, and in today's video I want to go through some lower back and pelvis resets that you guys can do on your own with minimal equipment or with the use of a loved one, your dog, your cat, brother, sister, someone. It's real quick, real easy, and they have huge effects as far as resetting the pelvis, decreasing tension in the lower back, lowering overall stress. Lower back pain is the number one cause for why people go see physicians. 80% of the population has lower back pain at some point or another. And these are quick and easy little things that you guys can do on your own. Anytime I get someone on my table, for whatever reason it could be, shoulder, foot, ankle, whatever it is, I always look at the SI joint, your sacroiliac joint, because if that's out of alignment, the chance of that pain going away is lower. So I start by clearing that, and then I kind of see what effect it has on the other extremities. I've seen fixing the SI joint, the hips clear some weird things, from Achilles pain, calf tightness, to groin, lower back, hamstring tightness. So these are things that you guys can do on your own that hopefully has just a profound effect overall on the most of the lower body stuff that you guys have maybe going on. It's something you can do standing up. I'm just going to teach you guys some of these things to do laying down, because you can do it in your bed before you get up, before you go to sleep. Again, they're real quick, real easy. Let's go through it. First place I like to start is just lay on your bed, lay on the floor, lay on the table. And what you're trying to do is you're trying to make one leg longer, one leg shorter. So you're trying to use your pelvis, and you're trying to shimmy your pelvis up and down, right? But I want you to go so slow that if someone was in the room, you could not see, they could not see what you were trying to do. Like right now, I'm going to exaggerate a little bit so you can see, but I'm trying to raise one hip up and one hip down, while trying to keep my legs straight and trying to keep my butt on the ground. So I'm not trying to lift my butt off the ground like this or off the table. So nice and easy, and maybe do this for a minute, right? And then see what effect that has. If you have someone that you want to do this with, have them first see if your ASIS, your bony hip points are even, and then do this. More times than not, I've found that the right side is going to be lower than the left side, and this is a quick and easy way to fix that. Now, if that doesn't work, what you can try, and again, if you don't have a mini band, that's okay. The use of a loved one is fine too, right? So what you're gonna do is put the band around the knees. You're gonna bring your heels toward your butt. You're gonna push your knees out like you're trying to do a clam, right? And then you're gonna try to do the exact same thing. One leg longer, one leg shorter. Now, if you don't have a mini band, have someone push against your knees and you're trying to push out. So we're trying to activate the glutes and the hip abductors as we do this. Right, and again, do it for a minute, two, doesn't really matter, but go so slow that the person in the room cannot tell what you're trying to do. Right, and then the other version, the last version, this one's a little bit harder. It's kind of one of those pat your head, rub your belly type of things. There's a lot going on. It's not easy to do, but this one I find is kind of the best one as far as resetting the pelvis. I'm going to use a yoga block. You can use a pillow, you can use a stuffed animal, you can use a soccer ball. It doesn't matter. If you don't have a mini band, again, have a loved one stand behind and push against your feet. I'm just going to keep the band around my feet. I'm going to lay on my stomach. I'm going to bend my knees. I'm trying to squeeze the yoga block with my knees, right? So I'm trying to adduct my knees. I'm going to push my feet out into the band. So I'm going to go into a little internal rotation. I should feel this in my hips, and then I'm going to try to make one leg longer, one leg shorter. Again, I'm trying to exaggerate for you guys, so hopefully you can see what I'm trying to do. And this is not easy. You should feel this kind of right in your tailbone, right in your coccyx. Now, once you've done that, hopefully you stand up, things feel a little bit better. Another little thing I'll do to reset the SI joint is I'm going to do it at the end of the table. Again, you guys can do this on the floor. Not a big deal. I'm going to lean back a little bit, and I'm just going to rock my legs towards my chest 3 times. I'm going to rock side to side 3 times, and then I'm going to bring my knees back and forth 3 times. Just trying to rock the pelvis. Then I'm gonna lay down. I'm gonna bring one leg over. I'm gonna take a deep belly breath in. I'm gonna pull my knee up towards my opposite shoulder and take a deep breath out. And I just felt a little crack in my SI joint. And I'm gonna do the same thing to the other side. And I feel some cracking going on. Now there are different types of lower back pain. So just to say you have lower back pain, it doesn't make it the same as someone else's lower back pain, right? So we're gonna go through a different type of resets or things that you guys can do, stretches that you guys can do, depending on what lower back pain or tightness you may have. Extension-based lower back pain is something that is quite common, especially athletes or people that run a lot and their lower back gets tight. So if your lower back kind of bothers you when you go into extension means anytime we're kind of in this posture, we kind of arch our lower back, then we want to do some flexion-based stretches, right? A couple of good flexion-based stretches, right? You can sit at the end of the table, you can sit at the end of a chair, you're just going to kind of bend down, wrap your arms around your feet, just kind of round your lower back up towards the sky, right? And you can sway side to side, but that's a good little thing that you can do for stretching lower back as far as a flexion based, or the other one, just kind of laying it back, bring your knees toward the chin and just kind of rock, right? Just kind of rock back and forth, but just kind of hug, right? Those are great flexion based stretches that you can do. Anyone that has problems now with flexion, see if extension feels any better, right? A good extension based one is a bridge, right? Where we're down, we're just kind of come up, right? And we're just kind of arching our lower back and just hold this, right? Let's see how that feels. Now, something that doesn't often get talked about with lower back pain is the role of the diaphragm in lower back pain. Breathing dysfunctions, breathing issues are more common than not. Not a lot of people realize that they have a breathing issue until it's brought up to them by a practitioner, by a professional. The diaphragm, if anyone's familiar with the diaphragm, kind of rests here underneath a little bit underneath the ribs, right? And it plays a huge role in respiration. But the diaphragm also is linked in with the lower back, and it also runs into the psoas muscle, which is a hip muscle, which helps with flexion. But when we sit all day, the diaphragm becomes kind of stuck underneath our ribs. Our psoas gets locked down into this flexion position, and when we stand up, that's where we can get some extension problems. So one way to reset the diaphragm is we're going to lay down. Okay, you're going to turn your head to one side, and then what I'm trying to do, if I turn my head to the left, I'm going to drop my shoulder down towards my opposite hip. Actually, I'll do it this way. I'm going to bring my shoulder down to my opposite leg. I'm going to turn this way. I'm going to give 2 big coughs. All right, and then I'm going to repeat to the other side. I'm going to drop my right shoulder down like I'm trying to grab my right knee. I'm going to turn my head as far as I can. I'm going to give 2 big coughs. And that fixes any NSRs that you might find around the diaphragm, okay? The diaphragm, the rib cage, right? They sit right here and the ribs run like an upside down Y. So once I've kind of done my coughing, reset, then I'm gonna have, you can have someone do this to yourself, or you can do it yourself, is try to grab underneath your ribs, and you're gonna just massage all the way up and all the way down underneath the ribs. Now try to hook underneath the ribs. Don't pretend we're petting a cat here and you're just trying to tickle it. Get underneath the ribs and try to massage. And if you find something sticky, you find something sore, you find something that doesn't feel great, spend some time there, it's okay. All right, but massage all the way up and all the way down. Okay, once you've done that for a minute or 2, then you're gonna take your thumb, and the sternum is a very powerful place as far as improving breathing. There's a lot of lymphatic there, and also a lot of people carry stress there, whether they know it or not. So then you're gonna take your thumb and you're just gonna kind of rub all the way up and all the way down your sternum. And you might find some tender points, some sore points, and that's okay. All the while, I want you to concentrate on belly breathing, right? Trying to expand your belly, try to get fat and try to get skinny. That's the way I try to teach it. It's not that we can't breathe with our rib cage, but if we're only breathing with our ribs, that is a sign of stress, right? So we want to be more of a diaphragmatic, more of a belly breather, right? I want things to go out like a balloon and then come back in, right? So once you've done that, those are great resets for the diaphragm. All right, this is my personal favorite stretch as far as improving flexibility in the coccyx and the SI joint. I do this daily. It feels awesome to me. It's something that I wish I was taught years ago to do. Maybe I wouldn't need it so much. This really helps me as far as just feel better, and when I get up, I just feel like my hips are butter. If you don't have someone, I use a kettlebell. If you have weights at home, use weights, but if you have someone, have them push down on you, have them lay on you. I'll sometimes have my 5-year-old son lay on my thighs when I do this, but this is an awesome stretch. I love this. I'll hold this for 30 seconds to 2 minutes sometimes, depending on how tight I'm feeling. If I'm gonna stretch my left hip right now, what I'm gonna do, I'll turn it back up, is I'm gonna lay down, I'm gonna slightly bend my right knee, I'm gonna cross my left leg over, and then what I'm gonna do is I'm gonna put the kettlebell on my left knee, and I'm trying to sink over to the other side, and I should feel a tremendous stretch here. While I'm doing this, if you feel the stretch in the opposite hip, what you're then gonna try to do is push your right hip, in this case, that way, so I get even more of a stretch through here. And I'm gonna hold this for some time. Again, if you don't have a weight, have somebody push down on you and go to the point where you feel a stretch. And this just feels awesome. I feel this all through here. All right, hold it for 30 seconds, anywhere from 30 seconds to 2 minutes, and then repeat to the other side. So I'm gonna slightly bend my left knee now. I'm gonna cross my right leg over. I'm gonna put the kettlebell around my knee. I'm gonna cross over until I feel a stretch in this hip, and I'm gonna try to push my opposite hip that way, and I should feel a stretch through here. Now, some people might feel, unfortunately, a stretch in their groin if you do this. And that's usually a sign that you got something going on as far as the adductors and its role and its tightness in some SI joint stuff you have. So you might want to try doing some hip mobility work before you do this, and it might make it feel better. So what I mean by hip mobility is do some leg circles, right? You're trying to lay down, do some big leg circles. You might get some snap, crackle, popping going on. That's okay, as long as there's no pain. Maybe go 10 one way, 10 the other, and then retry it, and hopefully you feel it more in your glute than you do in your adductors.